my name is Sue. I'm an occupational therapist in inpatient rehab, and today I'm going to give you a little bit of education on the CVA sling. We use these slings on patients who have had a stroke and have an affected arm that may be flaccid, or they lack movement or attention to that arm. So the sling has two sides. One is small, one is larger. The small one always goes on the elbow, and the reason for that is because we want the big one to support their wrist. So the way they put it on, as you can see, I have her affected arm supported on this pillow. We want to always make sure that their affected arm is in a good position to prevent subluxation in the shoulder. And that's the main reason why we want them to wear the CVA sling, is to prevent any subluxation in the shoulder and to protect the entire arm. So I'm going to grab the small piece and put it on her elbow. And then the larger piece goes under her arm and around the neck. And the reason why we like for it to go under the arm is because it puts less pressure on the neck. And then the bigger piece is going to go right here to support her wrist and her hand. This looks like it fits her pretty well, but if you need to make it smaller or larger, you can always adjust here. So we want patients to be wearing these slings anytime that they are doing a transfer in and out of bed, on and off of the toilet, to protect their arm. If they're sitting in a chair that does not have arm support, they can continue wearing the sling. But if they want to take it off while they're sitting and resting, that's fine. We can take it off. And then just make sure that the arm is supported and protected. You can use a pillow and just support it just like that. Thank you.
Hi, my name is Delphine. I also work in occupational therapy department in the inpatient rehab unit. Today I'm going to be talking about donning and doffing this cock-up splint. Okay, so this particular splint slides on to the patient's hand, and this area here is for the thumb. So I slide that through. And when I put this on, I want to make sure that it's far enough so that the patient's distal palmar crease, it comes just below that. And then I secure it between the web space and then the straps. Now, this particular splint has the metal stay down or the palmar side of the hand, okay? So you know you have a left and right if you see the thumb on the inside. If it were the left, you would see it on the inside of the left hand. So when using these splints, it's going to prevent the patient from flexing, extending, or radial and ulnar deviation. You want to know what the schedule is. Should this splint be removed, or should it stay on at all times? If it isn't to be removed, find out if it needs to be protected from getting wet in the shower, so you can find that out through the doctor's order. You also want to check for skin integrity, okay? Is it red anywhere? Is it causing the patient any discomfort? Okay? And we also want to get feedback from the patient to find out if it's comfortable. Maybe loosening it here, okay? The other thing that we want to know is the patient weight bearing? Are they allowed to put any weight through that hand? If so, then we want to educate the patient on alternative ways to get in and out of bed or to get dressed. The end.